How we doing, everybody? We are back. Dr. Foss, how are you doing?
Super. Amazing. It's been a great summer. We're closing in on the end of it. We're closing in on school. The school year's just starting up, and I got this, second grader now. Oh, Mason's going to be in second grade. It's wow, it's mind-blowing. They grow up so fast. Everybody always says that. It's so cliched, but when you have a 25-year-old like I do, and then a second grader and a preschooler, you get to appreciate, really have some perspective, right? Because you saw how fast the first one grew up, and then you get to maybe just sit back and absorb and be present with these little ones.
How are they doing for this time before school starts?
They're doing great. They're doing great. Mason's ready to get going to Aurora Christian, and then Hayden is going to the church preschool at Lord of Life. So,
Doc,
excited.
So this time of the year, it's very interesting for parents. Obviously, we're doing our Frazzled to Focus seminar. But back to school is such a weird time, and there's a lot of words that are thrown out. You know, ADHD, behavior. You know, your kids start meeting with counselors again. So I want to ask you, as a dad and a chiropractor, when you hear the term ADHD, what's the first thing that you think of?
Do we edit this one out at all? Because I think fraud, not fraud specifically, problem, but the solution is fraudulent that we've been told. All right, so maybe that better clarifies it. And wow, what a problem! Because I remember it was starting to be a problem when I first got into chiropractic. There was a lot of kids that were told they had ADHD, and that was in the early 2000s, and it actually really started skyrocketing in the 90s. So as a doctor, I say, all right, yes, there are a lot of kids that are frazzled, that are hyperactive, that can't focus, that have behavior issues. But the solution isn't calling it a specific label, calling it ADHD or ADHD inattentive, or somehow giving it some sort of better magical label. The solution is understanding why it's there, what's causing the problem. And that's my biggest frustration over the last 25 years of this, and helping kids for 25 years, is the continual focus on the diagnosis, on the label, because the diagnosis doesn't give us anything. It just gives us this is what's going on with the diagnosis. Mrs. Johnson, what's going on with Billy? Well, Billy can't seem to sit still, and his teachers are saying that he can't sit still and follow directions, and he's really kind of irritable at the end of the school day, so he's got all of these symptoms, and then they say, oh, let's take all these symptoms and these effects and call it something, instead of saying, well, what's causing these symptoms and effects? What are some underlying reasons as to why the brain and the systems are frazzled? And let's get focused on how to reprogram the system and how to actually get to the cause of the problem. Let's understand what's causing the problem and fix that cause.
Well, I can reflect on being a kid, and you'd come home from school. I'm sure you felt the same way. And you'd be tired, or, you know, if I'm a youngster, my mom's telling me to do certain things, and I'm talking back to her, or I'm trying to go play on my Xbox when I'm a youngster, right?
Right.
And nowadays, that's labeled as ADHD or a down the line of ADHD, and then we just throw these kids right on medication, where if I'm irritable, there's a reason why, like you've said. But it's an interesting topic, right? Because when we talk about how these kids get diagnosed for ADHD, the parents fill out a questionnaire, or there's minimal resources that they use to medicate your child. How do you feel about that?
Well, that's why I said fraud at the beginning, because it's just absolutely, to me, fraudulent what goes on in order to get kids on medications. So what they do is essentially you take them to a psychologist or medical professional, and they've got a checklist. You know, let's see here, a checklist.
He's got
these are the DSM-5 criteria to determine whether or not your child needs to be medicated. How often do you fail? Do you often fail to give close attention to details or make careless mistakes in work or school?
So firstly, these are the questions that, wow.
Do you often have trouble keeping attention on tasks or play activities? Do you often seem not to listen when spoken to directly? So essentially, if you have enough of these check marks, which is on children, 6 or more symptoms in one domain. So there's 2 different domains. There's an inattention domain and a hyperactivity domain. So if you check off 6 symptoms, and I've just done 3,
Yeah.
whether your teacher says these things or whether the parent says these things, if you check off 6 symptoms, that gives you the green light to start medicating kids. So that is the most pseudoscientific load of garbage, like non-objective, no objective scientific credentialing. What's the word I'm looking for?
I like the scans, right? Or
Yeah, but so
anything
that's-
to measure it, right?
So there's no measurement other than just symptoms. So we have behavioral symptoms, and that's what we're using as criteria in science in order to put a kid on medication. We're not doing any kind of testing whatsoever to determine why their nervous systems maybe not be able to focus in. We're just looking at the symptom, checking a box, and then writing a prescription, which is horrific healthcare. Horrific.
I'm not trying to get too crazy here, but the healthcare has to make money somehow. And now I'll hold off before I say anything too crazy here. But when I think about this, it's how are these requirements established for kids, right? Who is putting these in place for kids to be evaluated?
So
when we made a joke yesterday, we said that it's just people in a room putting their hands up saying, I do.
That's it.
Now, that's questionable as what really happens.
So what happens is that, all right, we get these questions, and if you check off, 6 of these things, so who develops those questions? So it's a group of doctors that are sitting at a table, and they say, okay, we're going to change the diagnosis of ADHD and ADD, because they don't use ADD anymore. They just have 2 different kinds of ADHD, ADHD inattentive and ADHD hyperactive. And because now it's clear. Now we know what the problem is because we got a different label. Sorry, you probably were picking up on the sarcasm on that, laying it on pretty thick. So yeah, they sit around a table. They say, all right, here's one of the criteria here. And you guys in agreement as this being a criteria for ADD? And if they meet enough of these criteria, we call it ADHD inattentive. All those in favor, raise your hand. So there's no blood test. There's no EEG. There's no any kind of scientific testing credential or biometric that they're using at all. It's all based on behavior.
Well, you mentioned the inattentive ADHD and the hyperactive, and I feel that gives a great leeway to one of the topics that's a focal point at Vital Wellness Center, and that's the fight and flight response.
Right.
In my personal opinion, I feel like hyper or inattentive would be the flight, and then the hyperactive, maybe I didn't use the right words, would be the fight response. So that's an easy way to be able to distinguish a kid that's got some things going on in their behavior or sensory issues as well. How do you think about that?
So let's break down the actual diagnosis then. So if we have a child with ADHD hyperactivity, all right. So what's making them hyperactive? What's causing this inability to focus and go from one thing to the other and have some probably behavioral issues too? So we first have to look at the nervous system. That's the key thing. That's the primary place to start. And if you're not doing any testing to see what's going on with the nervous system, how the neurophysiology is, how the signaling is working, if you don't have any idea about that, but yet get this label, then we're really just, we're just throwing like blind darts at stuff, seeing what sticks. And you don't want to throw blind darts to see what sticks when we're talking about Schedule II narcotics and what is ADD drug that a lot of kids are on. It's called
Adderall.
Adderall, right? And there's another one too. Gosh, I don't know why my brain's not working, but what they are is methylphenidate.
They're very strong.
Yeah,
right?
they can be stimulants.
They kind of like lull kids down, if that makes any sense.
And sometimes they say, well, they're not stimulants, so I've got another one that's non-stimulant. But either way, it's affecting their neurotransmitters. It's affecting their behavior. It's affecting their brain chemistry. And then we put them on these chemicals because they're told that, oh, they've got a chemistry imbalance, and they've never done a chemistry test. They've never checked neurotransmitters. They've never checked any of this. So why does pediatric, neurologically focused chiropractic, how does that differ? Why does it differ? Because we don't guess, we measure. All right, we measure the nervous system when we do that through different scans, and the scans can actually tell us if the sympathetic nervous system is in overdrive, and the sympathetic nervous system is the fight or flight response. So if the sympathetic nervous system is floored down and is in, well, like I said, is in overdrive, and the parasympathetic nervous system, which is the brake pedal that calms things down, if the gas pedal is down and the brake pedals are weak or shot, that's going to keep the nervous system in this fight or flight protective survival mind. And then that kind of neurophysiology, how the brain is signaling, is then going to be the root cause of all the behavioral things. You can't focus on one thing if your brain's thinking that there's a bear over here, a tiger over here, and who knows what else is going on over here.
Stress, right?
You're a constant in this protective stress response. And that's going to affect not only focus, but it's going to affect behavior. And when you can actually see that physiology on a scan and be like, there it is. You can see it on a thermal scan. You can see it on what's called heart rate variability, which shows us how the vagus nerve is signaling. We can see it on that scan. And then mostly, one of the best scans that we have is called an EMG, which is kind of like an EKG, but the EKG is measuring the impulses that are firing to the heart.
Okay.
The EMG is measuring the impulses or the current that's coming from the brain into the muscle. So with an EMG, if we have a lot of current, we call those raging bulls, we can actually see how much energy is being thrown into the motor system. And if you've got a raging bull, that's why you're ADHD, because the motor system has just got so much energy flowing through it. And then you've got another thing called a drunken bull. And these are the kids that tend to see more the inattentive. So they're not just wired and going everywhere hyperactive. They're just inattentive. We call those drunken bulls. So their EMG looks a little more asymmetrical versus high energy. It's just the motor system's just out of balance.
So you touched on the scans. And I feel like the scans are such an important part about measuring a kid's ADHD because you can see this. Now, it's tough for me to be able to put this in words for the viewer because I've seen my scans over the years and I've seen how I'm going to do a tough job being able to explain this, but we'll put something on the screen of the EMGs and the heart rate variability. These are good scans that people can see because they show kids or how a kid's nervous system is dysregulated.
Exactly.
And I feel like or moms and parents in general, the number one thing that they overlook is a child's nervous system. And we talk about this all the time, and I feel like I'm beating a dead horse when I say it. They look at the gut and, let's get him on vitamin D and vitamin B12, and let's get him on whatever, right?
Therapies. And,
right.
And all those things, again, not to poo-poo them. They're all very important. But what we have to do is layer them properly. It's like a recipe, right? If I don't know how to make bread, but if you put the flour in too fast before the eggs or the whatever, I don't know.
Yeah, you got to mix the wet and the dry,
Yeah, right. So there's a procedure and there's a sequence to do things properly, so you get a nice loaf of bread.
But nothing can happen if you don't get these scans to see how your kid's nervous system is messed up.
That's where the magic is, Jack. Is that when you can actually see where the neurological disconnect, where the short circuits are, why the brain isn't firing properly, or why it's too, gas pedal down, fight or flight, and you can actually see it and then track it and then correct it and then continue to track it. And as their behavior gets better, you see their scans improving. It's like, why doesn't everybody know this? Why doesn't everybody know this? Yeah. I've been saying it for 20 years. I've been doing this for 20 years, and it's it's now finally starting to gain momentum. And that's the beauty of this, is that we're gaining momentum. We're getting more ears out there that are listening to this, because parents are so sick and tired of medications. They just don't know where else to go. And their pediatricians and their schools and these people that they're trusting aren't telling them about this kind of care, because it's just not in their repertoire. It's not in the mainstream for some reason. I don't know. It's becoming more mainstream, but the reason it's becoming more mainstream is because of grassroots. People are seeing the difference with their children. They're seeing like podcasts like this, where we don't have to pay the Fox News or whatever to get on to spread the word. People are seeing this through their social media, through podcasts, through their friends, and the word is getting out because we deliver the goods. That's just it. Yeah. It's one thing just to deliver a bunch of hopium to people and not be able to back up what you're saying. Well, my goodness, when you get under the right kind of chiropractic care that addresses the cause and gets straight to it, proof is in the pudding, man. We deliver the goods.
Well, you mentioned that the resources that a lot of moms will lean on will be these school counselors, or there'll be pediatricians, or there'll be a health professional, whatever you can call them whatever you want, right? And they're feeding them the wrong information. So then when they see something like a EMG scan or chiropractic in general being posed as the genuine guide for them, for their child's health and their health, they obviously are skeptical. So they see the scans, they're like, well, these scans, what the hell is this scan? Pardon my French. They're like, what is this scan? What does the scan even mean? Right. But if you come in and you hear Dr. Foss talk, or you hear somebody genuinely talk about these scans, there is measurable growth with these scans, and you see it all the time. And it's not a thing that just happens once in a blue moon. This is every single patient that walks through the doors at Vital Wellness Center. They get scans and they see their scans. And if they're not a ton better, they will be better.
Yeah.
And it's so interesting because I'm being a dead horse, but these scans are so crazy.
So just to explain the scans just a little bit. So one of the scans is called heart rate variability, HRV for short, and the heart rate is controlled by the vagus nerve. The vagus nerve is what we see a lot of problems with kids with ADHD and sensory issues, because the vagus nerve is the brake pedal. It calms everything down. But the vagus nerve also connects to the immune system, to the endocrine system, creating hormones. So
it's an important spot back there.
Yeah, it's right here, right at the brainstem. And so if we can measure the tone of the vagus nerve and actually see if it's strong or if it's weak or if it's out of balance, that can give us so much insight as to why somebody would have behavioral issues, why they might have anxiety, why they would have immune system problems like allergies or autoimmune disorders, because that vagus nerve is critical for all of these health outcomes and health measures. So with a heart rate variability scan, we can actually check the tone of the vagus nerve and see where it's at and how it improves with chiropractic care.
Well, you got the vagus nerve on your shirt.
Oh, that's right. I got the atlas right here. Tap
that's the atlas.
Yeah, that's right. Yeah. That's where the vagus nerve exits, right? Yeah. And so the thermal scan is scanning what's called the autonomic nervous system as well. That's the gas pedal and the brake pedal. And gosh, I learned this one from an epileptologist, a neurologist, and he said, the skin and the brain are connected. And he told me how he looks at the skin-brain connection, and he did it through a black light, and he shone a black light on somebody's skin, and if there was different marks on the skin, he knew that there was a problem with the brain and nervous system, because he says skin and brain are connected. And I was like, yes. That makes 100% sense. I know this too. I just used a different tool. I used thermography. And so if the temperature of the skin, the thermal regulation is out of balance, that lets me know that the autonomic nerve system is out of balance. So we use thermography, go up the spinal cord and look for these imbalances. And that gives us great information on where the stressors are in the nervous system, where the exhaustion is in the nervous system that needs to be woken up, where the confusion is in the nervous system that needs to be tuned in. So with the thermal scan, we can look for neurological stress, confusion, and exhaustion, which is a lot of information. And then I already mentioned the last one with the EMG. That gives us how the tone of the muscles. So how tight they are or energetic and constricted they are versus normal tone versus low tone, which is fatigue. And a lot of parents that have children with sensory issues and neurodevelopmental issues, they know of the term low tone, and that is muscle weakness. And what I found is that you can't have muscle weakness. Most of the time, the low tone is in the thorax, in the abdominal region. But you'll also then find, coupled with that, and is that there's high tone here. So there's stress up here, which then causes fatigue down here. So you have to, the low tone diagnosis that they'll get from a pediatrician says, okay, well, it's low tone. I guess that's the problem. And that's, again, that's an effect. Let's actually fix that motor system, fix the high tone here, calm it down, fix the low tone down here, raise that up, and that can all be done with chiropractic adjustments.
I want you to talk to me about these chiropractic adjustments. Now, there's so many different arguments that people make with how it impacts the body positively, right, of course. And I want to get your personal opinion on, of course, it's the forefront. We've mentioned this many times before, and we spoke about this when you would say, in the next 5 years, what would you do? And you would focus more on chiropractic, right? We talked last month about having the hyperbaric and having the vitamin D, and they're all great, right? But you can't see any results, right, if you don't see the scans and you don't have the adjustments themselves. So I want to get your pitch about the adjustments, right? Because a lot of people are skeptic, and while a lot of people are waking up, what would you say to those skeptics?
When I say chiropractic adjustment, most people are thinking about the Instagram and YouTube versions of adjustments where you hear all the cracks and the pops and the Y strap and you're doing all.
It's a bad look. Kinda.
But there's some people that really like it. Like I like it myself. I like to get a nice release in there, but that's not where you're going to be doing.
For the gentle parent.
Yeah, for a newborn, you're not going to be putting a Y strap on them. Although that's what they had many times coming out of the birth canal. They used the OB's hands worked as a Y strap as they're stretching, twisting, laterally flexing, and pulling this baby through the birth canal.
One of the beginning causes of subluxation in a child, right?
So that's not what we're doing, though.
Yeah.
So let me break it down into basically two main forms of adjustments. There's the traditional high velocity, low amplitude. That's the chiropractic term. It's HVLA. That's the bone popping, right? Which we don't like to call snap, crack, or pop. Because I snap twigs in the fall. I pop popcorn, when I watch a movie, and I crack eggs on the weekend. But
it's just not it doesn't feel right. It's the feel.
Yeah. When it comes to children's and humans' nervous systems and spine,
we don't want to be cracking or popping anything.
Specific adjustments. Now, in those specific adjustments that are focused on balancing the nervous system, sometimes you need an old school traditional adjustment. If something is exhausted, fatigued, completely rigid and locked up, it needs to be released. You need to release that tension. And with our kiddos and our babies and our newborns, many times, and with adults too, you have to know when to bring out the paddles, so to speak, and get in there, and when to be very gentle and specific as well. And so that's what's called tonal chiropractic or low force chiropractic, where it's literally more like touch, or there's an instrument that delivers just light impulses.
Breathing,
And that light touch, literally just with fingertip connected to a specific neurological point on their neurospinal system, brings balance. So if something's really high and rigid and you want to you come in lightly, because you don't want to come in and do a manual adjustment on something that's already, really, really high and rigid. So it's knowing when to use the adjustment technique and where, and when you understand the different techniques that are needed for every single different person, that's where like the magic comes in, because then you know how to get the best results based on their scans. So you're being more scientific, more objective, and not everything is being, racked and cracked and locked and loaded. So that's the difference in chiropractic. So why would I take my little baby to a chiropractor? Well, you don't want to take him to just a regular
a normal, I don't want to say. It's tough.
Just a regular, a regular run of the mill, go down the street to
Old Joe,
Old Joe's chiropractic office, and he's going to get great results for a lot of people. But when they're talking about your children, and we're talking about autism and ADHD and behavior issues and immune system problems, you want to go to somebody who really understands the nervous system rather than just, Dr. Back Pain Bob over here.
So I want to switch lanes a little bit. I know we were having a great conversation about ADHD.
Yeah.
I want to get back to school.
Yes.
Because a lot of kids, they have this casual summer. I'm thinking about me when I was 10 years old. I was running around like a little idiot. And then school came around, and it was just mayhem, right? It was mayhem in the house. Now, of course, I have a twin brother and an older sister, right? So having siblings, it's a lot to deal with for my mom and my dad. But these kids nowadays, I can reflect on having a friend with a child. They are nuts, and they are crazy. They have the phone in their face like this. They're at like 3 years old.
Yeah.
And they're watching something, and then that kid has to go to school.
Yeah.
That kid has to sit in a classroom.
Yeah.
For 5 to 6 hours a day and
7.
learn, right?
And then after school things if their parents work. So it's so there's why are kids so like ADD these days?
I was going to ask something about that. I would say, why is the transition so hard for kids?
Yeah. Because they're nervous. They're usually already subluxated because they've never been checked. Most of the time, it's not like parents are like, "Gosh, you know what? Little Billy was just born. Let's get his nervous system checked," because it's not part of the programming, right? A lot of parents are doing that now, hallelujah, but it's just not part of the normal, everyday, traditional way of thinking of things. So a lot of these kids are already subluxated, and they have been for years.
And they're overstimulated.
And they're overstimulated with whatever overstimulates, whether it's
blue light.
phone, blue light, exactly, tablet, computers, all of that, or their diet can be overstimulating or understimulating, either toxic or malnourished. All right, so we got that, and that gets a lot of press these days. But the nasty food, whether it's toxic, filled with chemicals, artificial flavors, colors, preservatives, GMOs, that's just going to add fuel to the fire. It's going to throw gas on an already nervous system that's on fire. So pulling those things out is definitely going to help, but it's still not going to get to the depth that chiropractic will. And then just the sheer fact of the emotional stressors, like school starting again, all the different things that a child has to adapt to on just an emotional level. Then we start adding in chemistry that's either insufficient with goodness or toxic with badness. Mm-hmm. And then we add in the structural and spinal distortions that are at the root of subluxation as well. And it's a perfect storm for ADHD, behavior issues, immune system problems. So parents say, gosh, we go back to school and everybody gets sick. And then they blame it on germs because, again, that's our programming. Yeah. It's not the germs. Blaming germs for sickness would be like, if you had these car accidents that were happening all the time at this intersection, and you go look at it and you say, gosh, it's these skid marks that are causing the car accidents because we see the skid marks at every car accident. Well, it's like, no, the skid marks are part of the situation, but they're not causing the accident. A lack of stop signs causes the accident.
The common kind of worldview is that if you get germs in you, you're supposed to beat that, and that's how your immune system gets stronger, right? So these kids have a weak immune system, right? And that leads to their nervous system.
Or stressed out immune system too. Mm-hmm. So if their nervous system is stressed, their immune system gets suppressed. And then since it's a new school year, they've got all these new things going on. They've got EMFs and phone and tablet and food and all these things with an underlying root of subluxation that's already there. And then they go to school and their nervous system can't adapt to the environment. And their immune system isn't strong enough to be able to adapt to the environment. You add an extra stressor in, and then boom, the body says, all right, we got to clean house. And then they start expressing symptoms, whether that's a fall time cold, flu, and then the root cause is never really addressed. And then we medicate those symptoms and we say, oh, he's just got allergies. Oh, he's just got a cold. We'll just take something here, take something there, and not address the neurological root of what's going on. And yeah, that's the story.
I feel like schools, in a sense, kind of harbor some of these challenges for kids, right?
Yeah.
You're putting these overstimulated kids in a room all around each other, and the teacher might, and I'm not going to call them teachers at all, but some of these teachers, they don't do the best job in keeping kids super coordinated on something. So a kid's not overstimulated, but he's overstimulated while in school when he's supposed to be focused, learning something or working on something. So
yeah, the amount of tablets that are in schools right now and computer work, I'm just like, it's,
I was leaving elementary school and they started rolling in the iPads, right?
And then the school lunches, and then sitting in a chair.
I was going to say the lunches too. The lunches, right? It's sugar and it's these things that are not good for your kids, but many parents, they don't have another choice. They have to buy their kid the lunch. Yeah. Right?
Yeah, I know. There's a lot of uphill battles when it comes to the traditional programming and pathway that a lot of parents are led to follow. And it takes a lot of intestinal fortitude to buck that system and to do something different, because that's just where the funnel is going. And we wonder why there's so much allergies and asthma and ADHD and anxiety and autism in our culture. And all we have to do is think, well, what's everybody believing? What's everybody doing? Because if you believe and have the thoughts that this is how things have to be, and then you do what everybody else does, you're going to get what everybody else gets.
Yeah.
So we have to change. The first thing we have to change is our mindset up here and say, all right, we have to have a different belief system. We have to understand what's really at the root of this, so that way we can do things differently for our children and for our family so that we can get better results. And the thing that can really make the biggest shift in all of that is neurologically focused chiropractic care. And it's not just the chiropractic care. It's the big idea with everything else that goes along with it. It's the philosophy and principles of what a body needs to be healthy. We first got to start there, our belief systems. So that way, when we have a better understanding of what health is, where it comes from, and how to regain it, and we start from a different starting point, a different perspective, that it's not germs and viruses that are making our kids sick. It's not their genetics that are making them sick. It's the things that actually cause the germs to be there in the first place. It's the things that affect the genetics in the first place. And that comes through the education that we do at Vital Wellness Center with chiropractic care.
Well, your kids should be healthy year round. There should not be this wave of sickness that comes in.
You know, not consistently all the time. I'm not going to say everything is perfect under chiropractic care, because there's ebbs and flows. And thank goodness for fevers and, problems like this.
It strengthens these kids.
Yeah, it's the reset and the reboot. And not everything is perfect, but man, there's so much more ease and enhanced health when your nervous system is tuned through chiropractic.
So I want to touch on sensory challenges now. We've touched on ADHD a bit. We've touched on a little bit of back to school. I'll bring it all together, guys. Don't worry. But sensory challenges, right? Picky eaters.
That goes hand in hand with ADHD, really. Those are many times kind of like brought both diagnoses together. So go ahead. You were talking about.
I was just saying, what would you say about sensory challenges? Now, you said that it goes hand in hand with ADHD, and it comes down with checking your nervous system.
Yeah.
But from my personal opinion, a lot of parents don't really address sensory challenges as much as they address a kid with serious issues and he's moving all over the place, whatever, for ADHD. I know I did a bad job describing that. As for ADHD, it differs obviously from sensory challenges. They get put under the same kind of umbrella, but it's different. And I want to know, what would you, when somebody, like I said in the first question, when somebody says ADHD, what do you think? What do you think for sensory?
So I think they're very intertwined, ADHD and sensory, because a lot of ADHD hyperactivity comes from a sensory system that's out of balance. And the sensory system is part of the nervous system. And if we understand, all right, so senses, sight, sound, taste, touch, smell. Those are the 5 external senses. But then there's other senses that also have to be addressed. One is called proprioception, which is your body's internal awareness, like spatial awareness. There's another one called the vestibular system, which is kind of like velocity and also it's also in the same realm as spatial awareness, but it's just that there's more to it. But to keep it simple, you have your 5 external senses, and then you've got a handful of internal senses: proprioception, vestibular. There's also what's called enteroception.
And I want you to go on all of this.
Yeah,
this is
that's the gut. So the enteroception is the gut telling the brain what's going on inside. Proprioception is essentially your musculoskeletal system telling your brain what's going on inside of your body. And then the vestibular system, when that goes wrong, people a lot of times think of vertigo. All right, you feel spin, like you can't.
The spatial awareness.
Yes, yeah. But the vestibular system, that's just the tip of the iceberg, is the vertigo and that part of it, if it's off. But your vestibular system is actually, what it's doing is it's kind of the processor of all of the sensory information coming in. Sight, sound, taste, touch, smell, proprioception, your body awareness, all those signals are going up into your spinal cord, up to your brain stem, and your vestibular system is located in the C1, C2 area, brainstem, vagus nerve, in the cerebellum, all right, which is another relay center, right back here.
Yep.
And then there's vestibular function in the ears. That's why when people say, oh gosh, I have this vertigo, it's the vestibular nerve in the ear, and that's part of it too. So we have all of these external senses and internal senses, and it's processed by the vestibular system. If there's subluxation at C1, C2, the vestibular system doesn't work as well. Also, if there's subluxation at C1, C2, your proprioception, which is spatial awareness, goes down. That's why little Billy starts bouncing his leg, or he's got to get up and move around because his brain's like, I need to know where my body's at. I need to get moving. So that helps balance the proprioceptive system down. Your spine is like a proprioceptive organ. 60% of all proprioception occurs just in the spine. Right?
Yeah.
And about a third of that, 33% of all proprioception is at C1, C2. So your body's internal awareness is completely off the more subluxated you are. There's more static, more blown fuses in here, the less your brain's going to know where your body is, and your proprioception, no matter how much OT and PT you do, is not going to improve as much as it could than if you're then correcting your spine. Your spine is like key.
Do you feel like this is an easy fix?
It's a yes and no.
Like, let me go a little bit more in depth on this question. When somebody gets in and you see that their C1, C2 area is messed up and they start getting adjustments, is this an easy fix from there? There's still a lot of work that has to be done to really regulate this kid's nervous system. But you see it definitely is an easy fix. Now,
it's an easy solution.
Yeah.
It's an easy solution for sure. It's a lot better than medicating and then even having to take a handful of supplements or like elimination diet. Those things are going to help. But the thing that's going to give you the most traction and the biggest correction of underlying causes is getting to the neurospinal system. When you correct the subluxation, that improves the sensory system. It improves the proprioception, it improves all of those things. And now when the sensory system is calmed down, you don't have the sensory processing disorder. So now little things like having to wear headphones because the ears are so sensitive, those things balance out. And when the senses start calming down, or I should say balancing, because sometimes the senses are hyposensitive and they need to go out there and seek sensation. That's why they bang their head or they chew on really weird things. Like they got the thing called pica where they chew on everything. That's like, why are you chewing? And
on a pillow, bro.
On weird things, right?
Deodorant.
Because they're deodorant, all those things. Tide Pods, is that whatever.
No, dude.
But when your sensory system is out of balance, it's going to throw off your behavior, your focus, and all of those things. So tuning the neurospinal system is your biggest, most powerful way to get direct change in the sensory system.
I want to ask you about some internal stories at Vital Wellness Center because obviously we see a lot of kids that have issues. What would you say is a story for parents with kids that have children struggling, a story that's occurred inside Vital Wellness Center, maybe a story of growth with with a kid or change or really a success story?
Gosh, I'll start with the first one that came to my head was Tanya's daughter. Well, I'll just say Tanya, just to keep the names out of this. So Tanya's homeschooled, and but her parents could not get through their lessons in like less than like 6-7 hours, like a regular school day, right? And because she'd get off track and she would have outbursts, and they were at their wits' end because here they are homeschooling and not being able to do the things that, you know, it's almost like, geez, well, let's just send them to the public schools if we're not able to do the things that we can do at home.
Yeah.
Literally within the first 2 weeks, she went from having to take like 7 hours to get through all of the criteria. I don't want to call it criteria, the curriculum, to literally down to 2 to 3 hours. They cut the time in half. And she just was like now like getting through her work that she needed to get through. It was like night and day for them. There's another boy, Oliver, that comes in, and he has got autism. And you can see him now after we start balancing and adjusting his nervous system. He's starting to speak more now. He's more calm. Are these kids ever, quote unquote, 100% perfect again? Some of them get that way. Some of them we improve from where they're at so that they have a higher quality of life.
Some of them, the birth process is it's unfixable after the birth
sometimes, and sometimes it's toxicity
Yeah.
that damages the nervous system that is beyond 100% repair. But what we can do is improve it. Not medicate it, not douse it and suppress it, but have it express more life so that it has better balance and better quality of life. Because again, I think I said this on the last one, your life and your health and your nervous system, they're all intermarried.
Mm-hmm.
If you don't have your health, I mean, it affects your life, and it's life energy that flows through the nervous system. So if you can start connecting the nervous system with the body, that improves your quality of life.
What would you say parents should do if they suspect their child has ADHD or sensory challenges?
Yeah, obviously you want to go to it's called a PX doc. So PX doc chiropractors, which you can find on the PX docs website.
I'll put it on the screen.
Yeah, we'll put a link on there. So these chiropractors have had specific training on neurology, on scan techniques, scan interpretation, doing the neurological scans. So we've had all of the training and specific expertise on pediatrics, on neurologically focused chiropractic to be able to help your kiddos out. That's the best place to go because you know for sure they've had the training. There's other pediatric chiropractors you can go to. There's one called the ICPA, and that's also another good place to go to find a pediatric trained chiropractor. But I think the ones that are on the PX docs are just an upper level.
And finally, would you say that putting a kid on meds is irreversible? This is going to be a tough question for me to ask. When a child gets put on meds because they have ADHD or because they have sensory issues, are the impacts of those meds fixable by chiropractic?
Are they fixable? Yes, because I think the body can heal anything given the, as long as you remove the interference and give it what it needs. So, I don't want to put any limitations on anybody's healing. Are meds necessary? At times, you know what? At times I don't want to poo-poo meds because my son was on meds for anti-seizures for a while. And medications are great for putting out the fire, all right? But there's a huge drawback to medications. One is it's synthetic and it's like this, you know what? The synthetic toxicity of it isn't even the biggest problem.
But it's like not a God-given, like it's man-created.
Yeah.
That's how I see it personally.
Yeah, and that's not even the biggest problem, though, honestly. I think the biggest problem with medication is the mental connection to it, thinking that they need it. So it's the mental crutch that we have. So they're on these medications and we might be seeing some changes with them, but we're afraid to get them off. So it's the fear factor. That's the biggest part that I think medications throw a monkey wrench into everything. It's not so much the chemical part of it and the toxicity part of it, and can they recover from it? Absolutely they can. The biggest part is the mental hurdle that it takes to understand that they don't need it. They might need it for the short term to put out the fire, for instance, for a seizure or allergy or anything that's going on that all of a sudden there's like this crisis situation. You take the medication to get out of the crisis, to put out the fire, but you can't take, the fire analogy is the best one that I've heard of. So your house is on fire, you call the fire department, they come with their fire trucks, with their hoses and their axes, and they put out the fire so it doesn't destroy anything else, save lives. Mm-hmm. Perfect analogy for a medical system. They are great firemen when there's a crisis situation and you need something stopped immediately. But you can't use axes and hoses to rebuild the house. Firemen don't rebuild houses. They're great to save lives and to put out a fire, but if you want your house rebuilt and you want to restore your health the way it's designed, you got to find a carpenter or a construction crew, and that's what chiropractic is about. It's the carpentry to help rebuild the house, because it's your nervous system that's healing and regenerating and rebuilding and restoring your body's health and well-being. So if you want your body to be like full on rebuilding and regenerating, well, hook up to that fire hydrant, bro. Well, wait a minute. That's the wrong analogy again. Oh, shoot. But anyway, you can maybe edit that out. You get to the chiropractic helps rebuild the house.
One final message to moms and or parents with kids struggling with ADHD as they send their kids back to school or as their kids are going back to school. What do you got?
One, get plenty of sleep, because the sleep helps regenerate the nervous system and helps heal an exhausted nervous system, because it's neurological exhaustion that we see most of this behavioral and focus issues with. Make sure they get plenty of sleep, get their nervous systems checked without a doubt, because that can answer so many of your questions and your problems. You know, the simple things, eat less processed food. I mean, those are the things that you hear all the time. So I'll reiterate that. I mean, yes, eat less processed food. That's going to be important as well. But yeah, the number one thing is getting their nervous system evaluated and see exactly what's going on there first with these scans, because that's going to give you the best information.
Thank you, Doc.
You're welcome.
As for the parents and moms still watching, there's a lot of information there for sending your kids back to school, and we hope that all is well this school season.
You know what? Let me give you one little final thing with these scans and going back to school, because the things that most parents are, concerned about, or the things that they see a lot of. Again, ADHD, we hit that one. Sensory issues, we hit that one. Behavioral issues, we hit that one. But it's also the immune system issues. So with frequent infections, upper respiratory infections, asthma, allergies, all of these childhood issues can be corrected by correcting the cause of the problem through neurologically focused chiropractic. And we don't have to keep treating symptoms with medications or supplements or whatever. When you get to the root cause, you can really just help so many of these back to school problems that people have right away.
It's really a light bulb when you realize that the root cause starts in the nervous system.
Yeah.
There's so many things that are thrown at parents with take this and start stretching, whatever.
More therapies, right?
Yeah, more therapies.
This even goes with reading, learning disorders as well. It really sources back to the nervous system, reading delays, speech delays, all of these things that we're doing, all the therapies for, and trying to find something what we can take to help. And it's really, it all starts within, right up here, starting with the scans.
You are not alone, parents, and there can be healing. You are meant to be healthy. So we hope you guys enjoyed. Dr. Foss, it was an absolute pleasure. Oh, my keys drop out. But we'll see you guys next week.
Bye-bye.